I am your host, Nicole Will, and we're so happy you're here as we navigate the world with your aging loved one. We are here to come alongside older adults, family members, and the senior living community as we explore the world of aging and elder care with helpful resources, informative interviews, and approachable conversation. We get to do this together, so join us on our journey, and this is the willGather podcast. How do we avoid miscommunication and mismedication when we have those transitions of care? Today, my guest is Dr. Nancy Taylor. She's the founder and CEO of Taylormade Senior Advocacy and Consulting. She is a doctor of pharmacy, a board-certified patient advocate, and a certified senior advisor. She specializes in collaborative deliberation with clients and families and client care coordination. She is the perfect person to talk to us about how we navigate those transitions of care successfully. How do we avoid rehospitalization? We can learn how to avoid and protect ourselves and our loved ones from the complications that can happen during those transitions of care. As we talk through how Dr. Nancy supports older adults and families, we talk about what is transitions of care and why it's difficult and how people can slip through the cracks and have miscommunication and mismedication, how we can avoid readmission, why it's so important that we are health literate and understanding that med speak. What are those common types of transition of cares? What factors should be considered? And what role do healthcare providers play? How an advocate can help us navigate this time and how we can measure success, how we've been successful in this transition of care, and how Dr. Nancy Taylor can support all of those families and older adults. Here is my interview with Dr. Nancy Taylor. Hello, Dr. Nancy Taylor. We are here. We get to meet face to face and learn from you. I'm so happy that you're here. Thank you for joining me today.
I am so excited to talk with you, Nicole. You know, the back and forth we've been doing, and then yes, to finally have the face-to-face, to be able to, that's the whole nice thing about Zoom, I think, is we could be face-to-face no matter where we are, and it makes that connection.
It does. So much better. So much better. We're talking about such an important topic. You and I have discussed this. We're really passionate, and you are the expert to be able to guide us in really navigating a complex system, which is our healthcare system and those transitions of care. So I cannot wait to hear more about you and your background, but also then we'll dive into, how we navigate that as a family and as an older adult. So thank you. Yeah.
Absolutely.
How did you get started? Tell us more about who you are so we just can celebrate that.
Okay, great. Well, I am a small town woman, grew up in a little bitty town, and my family owned a business, a drugstore. My father is a pharmacist, owned the business. So I kind of followed in his footsteps. And so I've always seen that relationship between healthcare provider, but community member neighbor with patient community member neighbor.
Yeah.
You know, it is that tightness that you have with those people in your lives. And as I grew up in the business, we had to work the business. That was part of it. I watched my father work with all of these people. And one day he actually had a situation where via medication or anything, he couldn't help this person. But, what he did, he listened, they talked, and that person left the pharmacy feeling so much better. And I questioned him about it because I was young. And he said, Nancy, the one thing you have to remember, we're not just dispensing medications, we're dispensing hope.
Oh, wow.
And the fact that you can use your empathy, your kindness, your sense of humor, that goes just as far as any medication does in helping to treat these people. And that is something I've never forgotten. And so I brought that as part of what I consider holistic treatment. And when I say that, it's not the HOL. I believe in the whole person. So it's WHOLE, holistic.
Mm-hmm.
You know, we have to look at all aspects of the people that we're helping. And in my pharmacy career, where I did 14 years in community pharmacy, where I am right there on the front line with all of these people, I tried to make sure that I wasn't just dispensing a medication. These were not, oh, who is that? Well, is that metformin or is that gabapentin? I'm like, no, that's Mrs. Smith. No,
Mm-hmm.
that's Fred Turner. And like, we're not dispensing to medications, we're dispensing to people. These are people. So we have to know about them. We have to create those relationships. And I loved that part of my job. That was the part. And as those years progressed, and I realized that the demands of my company and my job and the were just getting to where I had less and less time with Fred, Mrs. Smith, whoever. And it finally hit me when I had a patient of mine who I saw in the grocery say, oh, I saw you the other day and I thought about waving, but you looked so busy. I didn't want to interrupt you. And I dang near cried.
Yeah. Oh.
And so I knew it was time to transition into a position where I could spend time with these people, that I could give them what I have in knowledge and empathy, and I can dispense that hope.
Mm-hmm.
And so that's when I decided to step from behind the counter out in front of it and start helping all of these people who need it before they get to such a stage where, you know, they'd feel there is no hope left.
What an incredible teacher that you had to just start your mindset in that way and have that be so powerful that it's about the people, and that shaped who you are and how you show up now for the people that you serve. That's really, really incredible.
I feel very fortunate,
Mm-hmm.
you know,
Mm-hmm.
and yeah, I have had a great role model.
Well, and it's served you so well in the sense of having that focus be on the people and the relationships, which is what we all crave as humans. I think we want someone to see us and be known and know what our struggles are. And typically, when we're interacting in that way with a pharmacist or with medications, we're not really as familiar with all of the things that encompass what that is. And so we need that guide. You know, we need someone to kind of show us the way or explain so we feel more comfortable. And today, being able to talk about those transitions of care and how you support families. First, what does that even mean? Like, what is transitions of care, first of all? And what are those most common types of transitions that families and older adults might encounter?
Excellent question, because starting with the definition always makes things simplified.
Mm-hmm.
So a transition of care is literally moving from one type of care to another. Here's a good example of that. You're going to go in for a procedure. All right. You're home. You're got your routine, your meds are set. That's exactly what you want, but you're going to have to transition into the hospital for the procedure. Okay. So that's the first transition. Many things can, and a lot of times do happen, whether the, you know, little mistakes along the way, we're all human. And so we want to make sure that there's a continuity of care as we transition. So as we go from home to hospital, we have to verify home to hospital and make sure that in that transition, all of our medications match up so nothing gets lost. Then, okay, you have a great procedure. It comes out great. You're going to need to have some rehabilitation. So you're going to transition from the hospital to a rehab facility for a short period of time as you learn how to do with this maybe newfound hip. And so there's your second transition. All right. Do we have continuity of care along the way? Do we have what we've had from home to hospital now to rehab? Are we looking at the same thing? And then, okay, you've done really well. It's time to go home. All right. So now we're going to go home and have we made a successful transition from rehabilitation to home? Are we still having that continuity of care now that we're home and we can get back into our original routine? So there's a really good example of how we move through different transitions of care. The reason we want to really pay attention in those transitions is because we want to avoid rehospitalization. And the rate of rehospitalization within the first 30 days after a procedure is in the 80 percentile.
Oh my goodness. That is much
Yes.
higher than I would ever think. Wow.
Right.
Mm-hmm.
There's a lot of things because there's a lot of players in transitions of care. So there's a lot of things that can happen that cause a breakdown. And it's those breakdowns that can enlarge over time. They can snowball.
Yeah.
And then if they aren't taken care of, you have that possibility of readmitting to the hospital because we've had a breakdown. So one of the things that I'm able to do, and it really helps having the pharmacy background because we are trained to be looking at each of those transitions, because dropped medications or medication errors or just general understanding and teaching to patients, caregivers, solo agers, families, just so that they can learn that can help avoid those breakdowns. And so we as pharmacists are key players when it comes down to that. And I am excited to get into that a little deeper so that we can let people know what that really looks like.
Yeah, I am too. And we need to, right? When we have numbers like that, where we know this is a concern and we know that it happens. How are transitions of care typically managed, right? Okay, if we've got this not old way, but the way that is happening that we need to do better. So, what does it look like currently and where does that breakdown happen?
Currently, we can see it in miscommunication.
Mm-hmm.
That's a big breakdown. So between miscommunication, data entry error, that's a big one. When we go into a hospital situation, as the patient and the caregiver, one, we're already nervous about what is going to happen. It may be our first time, and so we don't understand how it's going to work, how those things happen, and what we should be expecting. So we have unintentional breakdown that can happen just from lack of knowledge.
Mm-hmm.
But then we're now in a system where we may not understand how that system works, and that system works fast. You have people in and out of your room. You are seeing many different types of providers, from CNAs to registered nurses to specialists, whoever your primary care is, and whoever is the one doing your procedures. Mm-hmm. So you're going to be seeing a whole lot of people. It's a procedure. You're also going to have anesthesia. And so then we've also got brain fog. And they're moving fast enough in and out of your room, trying to make sure that you have the best possible care and outcomes. They don't have the time to explain every single thing to you unless you ask. And so learning how the process works, learning your role in it, because the patient and the caregiver have an active role. You are not passive in this. They're not doing everything to you. You have to be part of this, and you have to be part of it all the way through these transitions of care, because you ultimately are going to be your best advocate to make sure that everything is correct. And so we start with knowledge. We start with teaching you what the expectations are, what certain definitions mean, what your rights are as a patient and a caregiver, things that you can determine for yourself through this entire process to make sure that you are safe and we have continuity of care all the way through.
So that they're set up for success and we don't have
Exactly.
that readmission, which is what we're trying to avoid. Yeah. Yeah.
We want those positive outcomes. We want success all the way through. We don't want to have to go back in. And so one of the first things I do when I talk with patients and their families and solo agers, we have a lot of solo agers
I'm so
who
glad you brought
don't
that up.
have that person. So whether they bring along a friend or they try to do it all on their own, or maybe they hire an advocate, we start at home and we start to educate, and we start with definitions at home. And one of the first things that I talk about is you've got to make that medication list. And a lot of people have them, whether they've written it on a wallet card or they've got it on the piece of paper. It might be, on their phone or app if they're technologically savvy. So great. All right. In your medication list, you've got to make sure that you have the name of the drug, the strength of the drug, and how many times a day it's being dosed. Those things are really important because those are things that could possibly change. It's also very important to have all of your over-the-counter medications and your herbals and your supplements and vitamins that you're taking. This is everything. You want that list. All right. And then once you have that list, take a picture of it. Make sure you have it on the phone. So you have that picture in your hand and you can recall it all the time. You go into the hospital. One of the first things that they're going to go over with you is they're going to go over your medication list. All right. You want to be able that you can verify everything, not just oral pills, maybe insulin injections, or maybe you have specific once weekly injections that you're doing. So we need to make sure that all of those things are exactly put in to the hospital system the same way as you have them at home. And after you have discussed this with admission and the nurse, ask to see their list and compare it with what's on your phone. Did things get typed in right? I usually take a hypertension medication twice a day. Did it get put in twice a day or was it once a day? So as the patient, as the caregiver, before you even go in for your procedure, before it happens, you need to verify those things. And you have every right to ask whoever is doing the input and that to say, may I please see your lists now? I would really just like to verify that we have the same thing.
That's a really good tip. I've never thought to ask to look at what they've entered, but that is totally in our agency and capability to do.
It is. And honestly, it's our responsibility. As patients and caregivers, it's our responsibility, and that's part of that active role. Here's one thing, and here's that second tip when you go in. Because insurances are different, okay, you have your insurance that you have at home. These are the medications you're on. It is very common to see generic substitution while you're in the hospital because they have their own list. They have what their companies are going to pay for. And so what you take at home, maybe you take for your hypertension at home, there may be a generic substitution that the hospital is going to give you while you're in the hospital. And so you need to be understanding what those are, which is one reason we go back to double check those lists. And they may say, okay, I have everything on your list. That list goes to the pharmacy. The pharmacy will automatically do generic substitution for what's on their list. So it's really important to check the list again. So they're giving you these medications, and let's say it's day 2. You've had your procedure. Ask to see their list again. And if it doesn't look like what's on your list, then ask for clarification. It could very easily be one ACE inhibitor versus another ACE inhibitor, and you just don't recognize the name. But so you know that, okay, they're getting the medication. This is what the hospital requires they use. All right, I'm okay with that. I know that at least they're getting the medication. I understand it's a generic substitution. Fine, okay? So know that that can be different. The other thing I suggest too, when you're in the hospital, don't just take the little cup of pills. Ask them what they are. Ask them to point out which one they are. Because 1, you do have brain fog from having the procedure. And 2, could be a generic substitution, so it doesn't look the same as the one you have at home. So are you really getting it? And you have every right to ask those questions. You have every right to look at the label on the syringe before they give you your short-acting insulin to make sure I'm getting what I'm supposed to get, because there's a lot of different short-acting insulins, and it could have been a typo. You usually get Humalog, but this says Humulin R. Is that the same thing? That's not what I saw at home. Then you can question it.
Mm-hmm.
The antibiotic bag that they hang up there for you, look at the bag. Ask them. Because a lot of times nurses will say, these are your antibiotics. This is your pain medication. These are your regular morning meds. Are they?
Right. They're not specific. Yeah.
No, because they're coming in. They're doing their job. They're trying to do it efficiently, trying to make sure that you get what you need. But do you even know what you're getting? And that's how you can educate yourself. That's how you can know. You take that active role. So your spouse is the one who's had the surgery. The caregiver has every right to look at what is being administered. Before you do that IV push, what is that? Can you just explain to me what that is? And they will. They will do that. They'll take a minute and explain. If they say, oh, well, this is his antibiotic he's supposed to get 4 times a day. Oh, what antibiotic is that? I'd like to add it to his medication list. Great. Then you've been able to add that, and you've been able to then follow how often he's getting that. And then, is it on the discharge? Maybe he's supposed to be on that medication for 5 days after or something. Now you know. So that's just a little bit more education that you can use for that next transition of care.
Yeah. When we feel like we've got the information we need, we can make so much more better decisions for our loved ones.
We can, because everybody, their ultimate goal is to keep you safe.
Yeah.
We want success. We want best outcomes. We want safety. But we all know we're in a very fast-paced and multi-person situation. Who is the one that's continuous through all of it? The patient and the caregiver. They're the ones that are continuous.
Yeah, the constant.
So
yeah.
If we arm them with what they need to see that continuity of care is happening all the way through, then our success rate has shot up tenfold.
Completely. Yeah. And that's why we need people like you that can help guide us to do that and figure it out. Something that happens all the time is after we do have those procedures that you were talking about, we then go to a rehab facility where we can have therapy and have that transition. What is that like, and how is that different from other scenarios? I know we had talked about it being a little bit different since COVID happened. And so how can we navigate that?
This is a crucial moment, the discharge, whether it's discharging home or whether it's discharging to rehab. And you're right, COVID has changed how that is, because due to COVID, the caregiver is no longer allowed to accompany the patient. So when there's that transition, literal transition, that patient's on their own. And so usually what we would see is discharge nurse or comes in, or whoever's in charge of discharge, and we're going to see probably maybe some social work depending on where we're going to go, how many days will be paid, and all those kinds of things. But the one thing that the discharge nurse goes over is your discharge documents. They'll sit down with you and they'll say, okay, here is where you're going, here is your medication list, here, and we're going to discharge you at this time. All right, it's set up. Here's the thing. Because the patient is the only one going in transportation and the caregiver has to go their own transportation and meet them at rehab, we've lost an entire chunk of conversation. And when you're discharged home versus discharged to rehab, those documents are different and they are with a different person. And so what I always say is, when you're going to go from hospital to rehab, get a copy of those discharge orders. You ask for the discharge orders as the caregiver, because even as a patient, because discharge orders travel with the patient. So once they go over those with you in the room and you're going to rehab, you'll never see them again. Those orders go directly from staffing at the hospital to staffing at rehab. And you don't get to look at it again and follow up and make sure that you have in hand so that you can create that continuity of care. If you're going home, Yes, you get all the discharge papers. And then they throw in prescriptions and they throw in all of these things. And then you take this entire packet to the pharmacy and go, okay, my husband's discharging in 2 hours and they gave me all of this and I don't know what I'm supposed to give you. We see it all the time. And so, depending on where you're going is how you need to look at it. So the caregiver needs to make sure that they do not leave the hospital without a photocopy of those discharge papers. On discharge, let's just take the rehab as the example. Depending on the time that the patient is discharged from the hospital to rehab, the rehab pharmacy may not get the orders at admission. And so now you have admitted, but they don't have all of your medication orders. So if you know that you're going to rehab, take your home bottles with you, okay? Because that way you can work with the staffing at rehab to make sure that there's not going to be a missed dose just because the orders haven't gotten to the pharmacy. They haven't been able to process it through their pharmacy and get those medication cards out in time, and you're not missing your doses. So I always advise the families, make sure you take your home meds to that facility. They will say, oh, we can't use your home meds. We have to use our own pharmacy. Okay, I understand that policy, but now you're telling me that you won't have my husband's medication until in the morning, and he takes these medications at night. I will tell you, it's very common that the staffing of the facility will go to the family and say, we're not going to be able to get all of their medication before tomorrow. Is it possible that we can use his home medication in that overnight, that 24 hours to do this? Which is why you should always have those meds, because you can then make sure they're not missing medication.
Right. Yeah. And saving yourself, I think too, we are always stretched really thin. And when you are bringing your loved one and supporting them in that way, to then have to go back home or run around and track that down, that's going to be stressful. So planning ahead's huge.
Planning ahead is huge. And so, and then also you've got your med list. You've got a copy of the discharge papers. You're working with the facility. They're putting everything in an admission. And then you can again ask to see their medication orders. Do they match with the discharge orders from the hospital? And they should. And again, you're in another facility that has their own list of medications. So you're going to have generic substitution again. And so because you have that, then you're going to need to be making sure, okay, did my spouse get his ACE inhibitor that he usually gets from home? I know it was something different in the hospital and he got that.
Yeah.
Now, what's that ACE inhibitor that they're getting here in rehabilitation? Is it in that same family? Is it, so you're able to be that continuity of care through that transition. So you do want to ask to see their list. Now, I will tell you, they do have consulting pharmacists, and I am a consulting pharmacist for skilled and long-term care now, in addition to my other roles as an advocate. And my job in that is when we have new admits, I have to make sure that what was on discharge orders matches what is in admission. Was it put in correctly? Everything. Is it all correct? And if it's not, then it's my job to work with the staff to make sure it gets corrected as quick as possible, or something didn't get added in, make sure it gets added in as quick as possible. So there is that pharmacist there, and that's their job, but you don't always rely on that person. This is part of your responsibility and your role as the patient and caregiver. There's always, you got to love that there's somebody there who's doing that, but you still need to make that comparison.
And you share too about the importance of us being health literate, right? And having an understanding of what we're dealing with and learning and navigating so that we feel like we can make informed decisions.
Absolutely. And I will tell you, illiteracy it's a big breakdown. And when we talk about that, we can break it down into different terminology. So the term med speak out there, or doctor speak, is a term where the provider is talking at a level that the patient doesn't understand. And so there's where we can have that breakdown in communication. And so either learning what that is, one of the things we have to learn is not to be afraid to ask. I didn't quite understand what you were saying. Could you put that in different terminology so that I can comprehend what you're saying? Or we use a teach back. We use that teach back method. We've learned it our entire lives, is to repeat it to make it sure you understand. So the doctor tells you one thing and you can say, if I understand you correctly, this is what you're saying. Say it how you think it is, use your words, because then that provider is going to understand, oh, no, they're not getting what I'm trying to say. And then they will work with you on putting it in terms that you can understand. But you have to not be afraid to question, I guess, medical authority is one way to put it. And when we're dealing with older adults, we are dealing with generations that were taught you don't question it. And so we look at when we get families involved and we get those adult children involved who have been taught to question, we could have a little bit of abrasion between parent child and no, don't ask that. And like, no, we have to ask that. And here's where you can ask those questions. You can open up that conversation, because we've got to be on the same level when it comes to the safety of our medications and understanding it. So please don't be afraid to ask, because most providers will be excited that you are taking an active role, that you want to know about this, and that they're in that shared decision-making arena with you. And that will lead to success. And that leads to positive outcome.
And the care team, right? Looking at it as that we're all a part of that care team together. We had talked about how things that families and older adults need to look for, but how about on the other side of that? Like, what role do healthcare providers play in assuring a smooth transition of care? Or we hope them to play.
Providers play a key role, and they know that they do have difficulty in that shared decision making. And it's just, we talk about how patients don't understand necessarily the terminology, the medical terminology, or can't relate to that level that providers are. But providers, they want you to understand, and they want to put together a team. And that is, you will have a healthcare team, and you are a major part of that care team. And so providers realize that there may be that breakdown in communication. And providers also realize that they may be short-staffed in a nursing situation. I mean, we see that right now. We really do. We've seen that whole short staffing through COVID. And so they're moving at such a different pace that they know they can slow down and take a moment, but it's going to take the active role of the patient. Can you just take a minute here and explain this a little deeper to me? And then most of the time they will realize, okay, I need to do this. So it's important that way. And you can ask for multiple care members. You may not have to speak to the doctor all of the time. Maybe you want to speak to the consulting pharmacist. Maybe you need to speak with the floor nurse as opposed to the director of nursing. You've got this huge team, but we don't always realize we can utilize the team.
That is a great reminder.
Yes.
Utilize that
because
team.
There is this big team. You want to know what is happening at the moment at this particular time of day or whatever, your floor nurse is your go-to person.
Mm-hmm. Yeah.
Okay. You can't get your questions answered about maybe different kinds of medications or what this means or what this is doing from nurses or doctors. Request to speak with the pharmacist. They will sit down and talk with you about it, because we all are looking for that same successful outcome.
Right.
We're just all looking at it from a different perspective.
Which we need. We need all of those points of view. We've got communication, we've got medication. Is there anything else we need to consider in that transition of care to make that a little bit, run smoothly?
I think it's important, and I talk with my clients about this, is that you have your own personal health team. Now, this is not your professional healthcare team. Those are your providers. This is your personal team. This could be your family, your friends, your church members. When you're going through these transitions of care, it takes a lot out of the caregiver. It takes a lot out of the patient. And more times than not, we have friends and family and everybody saying, "What can I do for you?"
So true. Mm-hmm.
And 9 out of 10 times you say, "We're good right now," or "I just don't know," or something like that. Ahead of time, have your team together. Okay, people know that we're going in for this procedure, and my women's group at my church has offered to have meals. Take them up on it. Schedule it so that when the time comes, you don't have to worry about it. And they're taking care of it for you. They're part of your team when you get home. If it is easy enough to say, even you have long distance family members that want to participate. I see this all the time with adult children, that they want to be part of the care team, but yet they're long distance. How do they do that? One of the things I say is, got a computer, order your parents' groceries, have it delivered. If they need certain things, then call the pharmacy, make sure that those things are getting done. Maybe you're the coordinator of a certain aspect of home care. Okay, maybe it would make your family feel better and your parents feel better if the house were cleaned. All right.
That would
They're
make
in the
me feel
hospital.
better.
Order
Yeah.
to have someone come in
Yeah.
to clean the house, so that when they get home, we have fresh linens on the bed. We have food in the refrigerator. We have all this. But as the patient and the caregiver, we're so consumed with where we are in the care right now that we don't think about care of ourselves. And that's where that personal team can support you. And so I say, get your team together before any of this happens. And this is so important for solo agers. Have that team, have those conversations before anything happens, that you know who's going to step up and do what, because you need the help and all of these people want to give it. They care about you and they want to be there for you. So let them, and have that plan ahead of time.
Thank you. We need that reminder, and we need to know it's okay that we can do that, and we can ask people. I know I feel so much better when I offer and someone takes me up on it. I'm like, I love that.
Right,
Yeah.
because you want to help.
Mm-hmm.
You don't want to feel helpless, and they need the help. And sometimes it even comes down to, who are those people that see things that the family doesn't? Those are people that need to be on the team, because they're concentrating on one thing, and maybe that neighbor who's lived by them for years says, "Oh, we need to take care of dog walking." And they're not thinking about that, but you've got someone who's there thinking outside the box, that knows their routine, that knows, I can step in with this.
Yeah. And I think it's important too for us to say, if someone asks our support in something, I might not be really good at, I don't know, I'm just throwing this out there, like managing finances or something, but I know I'm really good at making food. So I think also using our voice and saying, like, here's where I can excel and help you and support you is great too. Because then you've got people doing what their gift is, and they're more apt to then want to support you too. So
Absolutely.
yeah. How do we measure success, that we've had a really great transition And here we go. Set up for success. What does that look like?
Success looks like we're healing. We're getting back to our regular routine and our life. We are now maybe pain-free because we've had this procedure and we've had no infection and we've had no drop in medication. And when we met our provider for our first follow-up, he looks at this and says, this is exactly what I want to see. Things are moving along. This is great. And so when we can look at that, that is a huge success. And I can tell you one of the biggest successes is we need to look at fatigue, appetite, sleep, those types of things. Those are successes. Were we able to get back to where we don't have the fatigue? We're back to eating normally. We're doing great. We're getting the sleep. Our activity level is up. So by keeping all of these, lack of communication as the barrier, and maybe the medication as the barrier, and not having that patient and caregiver fatigue, we've created a success right here. And we're not going to be readmitted. We're making sure that everything is set up along the way by having that plan. And one of the things that I do talk about, and I encourage many people, is I have a transitions of care checklist. And I think when families have that they can look at that and go, yep, okay, done. Oh, yeah, I forgot about that. I need to do that. Where they can literally have paper in hand as the reminder, go through the checklist. It sets them up for success.
Yes. How helpful is that? Okay, so where can we find that? And tell us all that you do to support and advocate for families and where we can learn more, because I think that it's so important people can find you, reach out to you, ask questions, and feel supported. Yeah.
Absolutely. So the Transitions of Care checklist is available on my website, and that website is www.drtadvocacy.com, and that is drtadvocacy.com. And on there are a lot of information. There are blog posts on there about simplification, about even transitions of care, or what should you ask? When should you ask? There is a lot of information on my website that can give you knowledge for different situations. But absolutely, you can go on there. There's put in your name and your email address and click, I want that checklist. And it's going to take you to where you can print off that checklist and make sure it gets to your entire personal team. Make sure it gets to all those family members. You've got those long distance adult children that say, well, Mom, did you go over the checklist? Because I see here on the checklist that it says we're now at this stage. So did you do this? That's always good to be able to have that. And people can reach out to me. I am available by email at Nancy, standard spelling, Nancy, at drtadvocacy.com. You can call me. My phone number, all my information is listed on my website. And again, that's drtadvocacy.com. I'll be happy to discuss situations with you. You can get that checklist. You can see what I'm doing for education purposes. There's just so much information out there to help you lead a successful, healthy aging process.
And it's so hard to cover it all in this hour. So it's so nice that you've got so much information for people. They're able to grab it at their fingertips and reach out to you. You also work one-on-one with people. You can help them navigate the world of healthcare and support them in that. So thank you for sharing all that you know with us. Gosh, to be like in your brain and have all of that knowledge must be pretty awesome.
Which is why I talk so much about it, so I can get it out of my brain, so that I can share this, because if you know it, you can put it into action, and you can create your own self success.
100%. Thank you, Dr. Nancy. It's a pleasure to visit with you. So thank you
Oh,
so
I've had
much.
so much fun today, Nicole. I really have. And this has been so wonderful to talk about this. I just really appreciate this. I hope that the listeners come away with knowledge and a few little clinical pearls that they say, oh, I'm going to do that. I've got this coming up. Oh, I'm in this situation right now. I can do this. And everybody go onto my website and get that checklist.
Yeah.
You will not be sorry. You will need it at some point.
Absolutely. At any age. I mean, I was just in the hospital, so I could have
Right?
used something like that. So thank you. Thank you. It is so valuable and very appreciated.
You're so welcome.
Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.